Before we begin, this video is general health education, not personal medical advice. Dehydration often starts before you feel thirsty. Your body sends early warnings like fatigue or mild headaches. These are subtle signals from your biology. This isn't medical advice but science, exploring how dehydration affects you and what those cues mean. We'll uncover when to notice them and why listening matters. Dehydration occurs when your body loses more fluids than it absorbs, like when you sweat a lot or don't drink enough water. Normally, your kidneys adjust to keep fluid levels stable, but if they can't keep up, your blood thickens, making your heart work harder. Your brain picks up on this and sends subtle signals: fatigue, darker urine, or mild headaches. These aren't just thirst cues, they're early warnings that your body is struggling to maintain balance. Your brain acts like a fluid monitor. When blood thickens from dehydration, sweating, or illness, it triggers subtle signals: fatigue, darker urine, or mild headaches before thirst kicks in. These aren't just thirst cues. They're your body's way of balancing fluids early. Think of it as a quiet alarm, guiding you to rehydrate before discomfort sets in. Thirst isn't always a clear signal for dehydration, especially with medicines like pain relievers or antihistamines, which can alter how your brain senses fluid balance. MedlinePlus. Older adults or athletes may ignore early cues like fatigue or darker urine until dehydration affects performance. Subtle signs, such as mild headaches or unusual tiredness, often appear before thirst kicks in. Your body sends subtle signals long before your mouth feels dry, like darker urine or mild headaches. These happen because dehydration affects fluid balance in your blood and tissues. Over-the-counter medicines, like pain relievers or antihistamines, can change how your brain senses these cues, making you less aware of early signs. Age and activity also play a role. Older adults or athletes might ignore fatigue until dehydration is already impacting their energy or performance. These signals are your system's way of adjusting like a quiet alarm, so listen to them before they become louder. Your body gives you early warnings about dehydration like darker urine or mild headaches before your mouth feels dry. These happen because dehydration changes fluid balance in your blood and tissues. Over-the-counter medicines, like pain relievers or antihistamines, can make these signals harder to notice. Older adults or athletes might ignore fatigue until dehydration affects their energy or performance. Listen to these subtle cues. They're your system's way of adjusting before they become stronger. Let's clear up some myths about dehydration. One common one is that you can't drink too much water. This isn't true for most people. While it's rare, drinking excessive amounts in a short time, like gallons at once, can dilute sodium levels dangerously low, causing symptoms like nausea or confusion. This usually happens with extreme behavior, not normal hydration. Another myth is that thirst alone means you're dehydrated. Actually, your body sends early signals like darker urine or mild fatigue before your mouth feels dry. These cues are your brain's way of adjusting fluid balance, so listen to them. Over-the-counter medicines, like pain relievers, can sometimes make these signals harder to notice. But that doesn't mean they're unreliable. Just pay attention to subtle changes in how you feel. To stay ahead of dehydration, build healthy habits like tracking your urine color. Pale yellow is ideal, and sipping water regularly, even without thirst. A balanced diet with fruits, veggies, and whole grains also helps maintain fluid balance. Just remember, over-the-counter medicines can sometimes dull your body's signals, so pay attention to subtle changes like mild fatigue or darker urine. These are early cues from your brain adjusting fluid levels. Don't ignore them. If you're dealing with severe headaches, dizziness, or extreme fatigue that don't go away after resting or drinking water, especially if over-the-counter medicines like pain relievers aren't helping, it's time to see a doctor. These symptoms could point to dehydration or other health issues. Your doctor can help figure out the cause and whether your current medications are safe for you. Always share all your symptoms, any medicines you're taking, even vitamins or herbs, and your concerns during the visit. Your body sends early warning signs of dehydration through subtle physiological changes. These signals come from your brain adjusting fluid levels, often before you feel thirsty. For example, mild fatigue or darker urine can be early cues. Over-the-counter medicines, like pain relievers, may sometimes dull these signals, so it's important to pay attention to how you feel. If symptoms like severe headaches, dizziness, or extreme fatigue persist or worsen despite rest and hydration, consult a healthcare provider. They can help determine if these signals are related to dehydration or other conditions. Dehydration hits differently during exercise. Your body loses fluids faster than you realize, especially in heat. You might feel tired or notice darker urine before your mouth feels dry. Illness like fever or vomiting also speeds up fluid loss. Sipping water helps, but if symptoms worsen, e.g., dizziness, rest and rehydrate longer. Over-the-counter meds can mask early signals, so pay attention to how you feel. If signs persist despite hydration, check with a healthcare provider. Your body sends subtle signals about dehydration like mild fatigue or darker urine before you feel thirsty. Over-the-counter medicines can sometimes mask these cues, so it's important to pay attention to how you feel. If symptoms like severe headaches, dizziness, or extreme tiredness don't improve with rest and hydration, check in with a healthcare provider. They can help rule out other causes. This isn't medical advice, but it's about listening to your body and knowing when to seek guidance. Stay curious, stay hydrated, and take charge of your health. Remember, this is general health education, not personal medical advice. For individual guidance,